Frozen shoulder is a really painful condition that can affect anyone, but usually those over the age of 40. Unfortunately, it affects women more than men. Definitely affects diabetics more, other people with metabolic disorders, but sometimes comes about after you've had a period of surgery into the shoulder, or you've had some trauma to the shoulder and maybe you haven't rehabilitated as effectively. For whatever reason, the body is sent into this inflammatory cascade which causes quite a bit of stiffening and inflammation of the joint capsule, which is the bit that holds all the fluid inside the shoulder joint. So we look at the shoulder joint, it's a ball and socket joint like this, and the joint capsule is this thickenings of ligaments and tissue to hold the arm bone in the socket and also house all the joint fluid. And it's that becomes inflamed and painful in a frozen shoulder. As I say, symptoms generally will be noticed as a gradual stiffening and pain in the shoulder. Now the stiffening won't be noticed until you try to reach into your back pocket or reach your arm above the head. You'll notice that the range of motion is significantly limited to the other side. The waking at night problem is very common, and that's usually what prompts people to do something about it, because sometimes if they keep the arm in this position it doesn't cause as much pain, but those sudden sharp jerky movements or lying on that side can really be painful. The important thing to remember about a frozen shoulder is that it's nobody's fault and it will get better. Unfortunately, it can take time. So a frozen shoulder can last anywhere between a year to 3 years, but they'll all get better. It just takes time. Now the best treatment approaches are usually trying to reduce pain, educate the individual about the process of the disease, how long it's going to take, and the types of things that you can do to help with your pain and discomfort to ease your symptoms so you can get a better night's sleep. If we look at the research, generally the best things that we can do in the early stages understand that the diagnosis is correct. So it's important you see a health professional and work out that it definitely is a frozen shoulder, or what we call adhesive capsulitis. If it's not that, then we might need to send you on for further imaging. If we're going to assess you in the clinic here, what we tend to do is do a thorough clinical assessment first. We'll ask lots of questions, when it came on, how you're managing those symptoms. Then we do a physical examination, and usually we follow that up with a diagnostic ultrasound in clinic as well. And that way we're able to see where the problem is coming from. And if it's a frozen shoulder, it's quite clear straight away. So once we've got the diagnosis right, our treatment options are going to be anti-inflammatory medication, paracetamol, to try and reduce the pain so that you can sleep, so that you can go about your activities of daily living with less discomfort. Now, unfortunately, some people can't take anti-inflammatory medication, and for some people they don't want to take anti-inflammatory medication, and even worse is those that want to take it but it doesn't give them enough relief. Now in those individuals, the best treatment approach that is in the literature at the moment tends to be a corticosteroid injection into the shoulder joint. So we go in using ultrasound guidance, we insert a needle and we put a steroid inside the shoulder joint, and that helps reduce the inflammation and pain in a really acutely painful frozen shoulder. Now sometimes, if we've also got stiffness with that, we might increase that treatment effect by doing what we call a hydrodistension. So we inject a bit of extra saline inside the shoulder joint as well and stretch the joint. Immediately after that, we mobilize the joint and we do lots of aggressive physiotherapy to try and get your range back. While that steroid's working inside the shoulder, we like to mobilize as much as possible so that we can get your range back as quickly as possible and maximize the treatment effect of having the steroid injection. So in summary, the first thing we need to do is get the diagnosis. Once we've got the diagnosis, we can discuss treatment options of anti-inflammatory, pain-killing medication and potentially steroid injection if you're the right candidate for that. If you're a diabetic, we need to discuss with you the effect that steroids can have on your diabetes control. And if you're taking anticoagulant medication, so blood thinning medication, we also need to discuss that with you in advance to make sure that we can do the treatment effectively and not affect the other medications that you're taking. So if you've got pain in the shoulder that's come on gradually overnight, you've noticed it's a bit stiff and things are not getting better with conservative treatment, it's best we take a look and get the diagnosis right and start you on the course to recovery.